Welcome to the ACO Show, a podcast about the American healthcare system and some of the people who are working to make it better. I'm Sean Cavanaugh, and I'm joined by my co-host, Dr. Josh Israel. Welcome, Josh.
Hey, Sean. Glad to be here. And we often have people who are on working to make it better through their clinical work or their policy work. Today, we had a couple of guests who are doing it through clinical work and through sharing their experiences. We had Dr. Ryan Knopp, who is a former medical director at Aledade and still is an Aledade physician. He is a family physician in Manhattan, Kansas at Stone Creek Family Physicians. And his daughter, Amelia, who is a junior at the University of Kansas.
Yeah, and Amelia is, as you said, a college student, not a clinician, doesn't work in a practice, but she related her experiences as a patient and interestingly is turning her experiences as a patient into becoming one of those people who are working to make the American healthcare system better.
It's almost too bad that we need to hear direct experiences to be reminded of what it's like to be a patient. You can get so lost on the policy or the clinical side of things, and intellectually that there's human stories on the other side of it, but really nothing gets it across like these emotional stories.
That's a great point, Josh. The other thing that struck me is, you and I work at Aledade. We work almost exclusively with primary care practices, but it turns out a lot of the lessons we've learned and a lot of the tactics we apply extend well beyond primary care. And Amelia did a great job of drawing those parallels to her experience with emergency rooms, ICUs, oncology departments, and sadly, a whole slew of specialists.
You and I sometimes try to impart lessons on this show, but I was glad to have guests on who could do it much more powerfully than we can.
So let's listen to Dr. Knopp and his daughter Amelia as she relates her scary, but ultimately hopeful and enlightening trip through the American healthcare system.
We are now joined by Dr. Ryan Knopp and his daughter, Amelia Knopp. Welcome to you both.
Thanks. Great to be here.
Thank you.
This podcast came out of Sean and I watching a presentation that you both did that was very moving. I don't get choked up often, but I did hearing your story. Amelia, you're now a junior at KU, is that right?
Yes, it is. I'm in my junior year.
Okay. We don't take sponsorships, but if you want to take a commercial break at some point and say Rock Chalk, Jayhawk, you're both welcome to. I know you're already both dying to say it.
Yes, Rock Chalk.
Amelia, this story starts in your junior year of high school, is that right?
Yes, when I was 17 years old.
Yeah, how did it begin?
So I was in my junior year of high school running my junior season of cross country. And I noticed kind of as we were nearing the postseason towards the league championship that I was starting to have some more fatigue and some back pain when I was running. And that kind of culminated in the league race when I was aiming for a top 3 or 5 spot in the race and ended up barely finishing and collapsed at the finish line. And I didn't know what was wrong at that point, but I knew that there was something wrong and my season was definitely over. So from that point, it was just kind of a waiting game over the next few weeks to see what happened. I started to experience those symptoms outside of running. I ended my season, and as I was in class or I was in band one day, I almost fainted, started to feel dizzy. The back and stomach pain intensified, and that was when I went into the doctor's office to get my lab work for the first time, and my dad rushed me down to Children's Mercy right when we received those results.
Dr. Knopp, what did those results show that made you rush her to the hospital?
Yeah, so her blood counts were super low. Her platelets were critically low. And obviously you hope that it's not going to be the worst case answer like a leukemia, but in your heart and mind, that's the path it's going to head towards. And so we pretty quickly got in the car and headed down to Children's Mercy in Kansas City, a couple hours away from us. And within an hour or two had confirmation of the diagnosis of leukemia. And that set us as a family and Amelia personally on a journey that was pretty challenging, I think is safe to say, harrowing at times, heart-wrenching at times, but also one that I reflect on and think, well, it's not often in life that you get to identify your hero as one of your own children. And that has happened for me with Amelia. Her resiliency and strength, character, all the things that she's displayed over the last few years have been amazing. And you'll hear that in some of her story here, I think.
Yeah, Amelia, one version of this story is you're diagnosed with leukemia. It's scary. You go through some awful chemo. You come out, you're fine. You go to college. But that was not your experience, was it?
No, there were definitely a lot of major, I guess you could call them road bumps, maybe a little more intense than that along the way. From that diagnosis moment, embarked on 2.5 years of intense chemo, ran through about every rare side effect and complication that's in the book. And as I got to ring the bell, about that time was when we discovered that I had avascular necrosis and basically all of my major joints. So from that point, I had four joint replacements, 2 shoulders and 2 hips over the course of about 13 months. So even past that 2.5 years of treatment, I've had to go through some significant operations and recovery periods while also balancing college and trying to get the most out of that experience as I can.
There were some moments in your journey, as you described, where things seemed very, very perilous. Among them, a point where you were spiking very high fevers, were in and out of consciousness, and turned out to be septic. Were you aware during that period of time?
So that was my first weekend after diagnosis, and I'd gone through my first week of chemo, got to go home on that Friday, and about just a couple hours after we got home, I started to feel unwell and weak, and that's the point when we checked my temperature, and I discovered as a newly immunocompromised person what that meant, which was that we needed to get in the car and head down to Kansas City um, and check into the ER. So the last things I remember from that weekend are arriving in the ER, trying to eat a little bit of a snack, throwing up, and getting in a wheelchair to go up to the oncology floor. And from that point, I don't remember any of the rest of that weekend.
So Amelia doesn't remember so well, but Ryan, you do quite well.
Yeah, that's right. There were, we've had many, many harrowing journeys. That was probably the first one. We call it sepsis weekend. So she had bloodstream infection. And, there were 3 nights where I basically laid sleepless on a blow up mattress in a hospital floor, staring at her heart rate and vital sign monitor, just fearing for her life because she was critically sick. And everything really went on a downward spiral there through the course of the weekend. Kind of multi-organ failure along with the sepsis, and really got to the point where honestly, in a moment of lucidity for Amelia, when she could somewhat understand what was going on, we had sort of a first version of an end of life conversation, which was one of the toughest things I've been through as a father. Had to call grandparents and family members with words like, I don't know if we're going to make it through this weekend. It was really tough. And there were, that being said, some sort of miraculous events that happened that weekend, thankfully, to help her to kind of come through that and to become healthy and get better through the week ahead, which sort of ties in, I think, to some of our lessons learned, on this journey and sort of how we came through it as a family and what maybe I've learned as a physician and Amelia's experience as a patient that's important, all kinds of experiences that we never thought we'd be through.
Amelia, do you know how many times you were in and out of the hospital during this whole journey?
I mean, for those first 2 or 3 months, it felt like about every Friday night there would be some emergency, and we'd be, after a full week of chemo and being in the hospital almost the whole week, I'd go home and need to immediately head back for an emergency over the weekend. So those first few months it felt like a constant stream of appointments and emergencies. But after that point, it kind of varied. There were times that I'd maybe go once a week. There were also times that I had to go every other day to receive an injection of chemo. So it definitely feels like I've spent my fair share of time in a hospital setting.
Amelia, when I saw you speak about this previously, you talked about several things that happened not in the hospital and not clinical, but that you thought were an important part of your journey from your friends and community. Can you tell us about those?
Yeah, I think my whole experience is really just a testament to the power of advocates that were surrounding me and supporting me throughout the toughest times and are still here supporting me as I kind of emerge from this experience. And so going back to that first time that I got back to went back to the hospital, that first night that I had my fever and later went in for what we called the sepsis weekend. When I got home that night, I arrived to a yard display in my yard that my friends put there, saying "Welcome home," and they were excited to see me back in town and home from the hospital. And that support did not stop from. I mean, there was just an outpouring of love, obviously, in those first few weeks, but that I felt that constantly from my friends and family and community members, and of course my medical team as my supports and my advocates. So I'm really grateful for all of that.
Ryan, you've been a physician for a good while. What was your experience of being on the other side of it?
Yeah, a few perspectives. I mean, one, just to lift up Amelia's point that, she would say she would not have survived this journey without multiple advocates. And that's a friend, family, community-based source of advocacy and support. That weekend that Amelia's talking about with sepsis, I mean, it's such a harrowing weekend. It does have a happy ending, which is, while on Saturday night and Sunday we were having end-of-life conversations, by Monday morning she had made a miraculous turnaround. And I attribute some of that to the advocacy of a community of people who prayed for us and supported us and helped in some ways a miracle to happen that by Monday morning she made a remarkable improvement. What I call the rest of that story also happened on a Sunday afternoon before the turnaround. And that may be one of her moments of being the sickest. I had my wife say, "Ryan, you've got to do something here because our daughter is dying." And I'm not one to step on toes. As a father physician, I just want to play the father role in that moment. But I found myself a little bit having to enter the mindset of a physician. And I sort of questioned some of the healthcare team about, do we need to broaden antibiotic coverage? Because at that point, we were just on a single agent. And long story short is we didn't know this at the time, but Amelia had an infected colonized port that was seeding her bloodstream and led to repetitive hospitalizations before we figured that out. And it was a methicillin-resistant staph bacteria that only the antibiotic vancomycin would control. And that morning that I kind of quizzed the team on the broadening of the coverage, I said, "When do we go to that antibiotic?" And they kind of gave me their protocol. And I said, "Gosh, I feel like we're there. She's so sick." So within the hour, that antibiotic was started. And perhaps in some ways you could say in that moment, I was also advocating for my daughter and perhaps helped, in that moment to kind of help her to improve and get the treatment that she needed. So it was a tricky balance, to answer your question, Josh, being both father and physician. But I think the take home is just the advocacy part. And I reflect on that, in my lessons learned as a physician, which is, it's right and good for patients to advocate for family members, but sometimes we in primary care are the only advocate that the patient has. And we have to have and answer that call to advocacy. If no one else will fill that role, we always should be, the advocate for our patient. It just really drilled that point home for me big time.
Amelia, I know you came away from this with a number of lessons and reflections on our healthcare system and what worked well and what didn't. One of the things you talked about was communication. Can you share how you experienced the communication in our health system and why it was so important to you?
Yeah, I mean, this weekend that we're talking about is just one of the many examples of harrowing times throughout my journey. And I think something that proved to be absolutely critical in each of those toughest moments was the power of communication. And as a patient, kind of thrown into this new world of blood transfusions and chemo and complications, I felt sometimes helpless, and I completely trusted my team to make the best decisions and take care of me because they were such good communicators. And so we kind of have, just for an example of a story of this communication, I one weekend started to I was doing chalk in my driveway and my right hand went numb, and I kind of thought I was just making it up, but I waited a little bit and it persisted. So I told my dad, who was then worried because I couldn't hold a pen and write my name on a piece of paper that I was having a stroke or having stroke-like symptoms. So to make a long story short, I ended up being life flighted to Children's Mercy, where by the time I landed on the top of the building, I had lost feeling in both of my hands. And as I tried to talk to the helicopter pilot, my speech was slurring. So this was hands down one of the scariest, if not the scariest moments in my whole medical experience. And so it was kind of one of those moments where I didn't have an answer. We didn't have an answer yet. But as my dad can kind of go into, this was one of the moments where communication proved to be one of the most impactful skills that or gifts that my medical providers shared.
Dr. Knopp, what were you experiencing there on communication? How did it work for you and the family?
Yeah, also, again, one of those really stressful moments. I was in my car flying down to Kansas City as quick as I could to meet her in the emergency room. And when I got there, she had gone from one arm, one leg being numb and weak to when I got to the ER at Children's Mercy, she could not talk at that point, could not walk, couldn't move. I mean, really, in my mind, what I thought were full-blown stroke symptoms. So Amelia's in tears. She can't communicate. She can't talk. And we kind of waited there for a while and weren't really getting much communication. So I walked out to the nurse's station and just said, I understand you're busy, super busy day in the ER, lots of priorities, but I have a 17-year-old in here who can't talk and can't walk and is scared out of her mind. And if someone could just please come in and kind of help us understand what's going on or what the next step is. And to his credit, a great neurologist came in then shortly later and talked through that. Thankfully, the MRI shows what ended up being probably a neurotoxicity to one of her chemo drugs, methotrexate, and not a stroke. So there was a path that this could recover on its own. Interestingly, the treatment is actually literally cough syrup, which is Delsum. And 24 hours later, Amelia made a miraculous recovery and all those stroke-like symptoms were gone. But the communication from the neurologist, a hospitalist that came in at 2 a.m. in the morning and sat bedside with her and explained all of her experiences with this type of chemotoxicity. Great examples of communication, but also providers going above and beyond, right? The hospitalist didn't have to come in at 2 a.m. and sit down for 45 minutes, but gosh, those things go so far to helping the patient and family navigate these experiences.
Can you talk about the role of physicians giving hope? And I have some questions at the end of it because it's something in my own practice I felt challenged with. So can you describe some moments where hope was so helpful?
Yeah, I think there were definitely some moments where I was listening so intently to everything that my care team was telling me and trying to glean the most hope out of their words that I could. And one of those moments came within the first few hours of my diagnosis when I first met my oncologist who was on the floor that weekend. And I will never forget what he told me and the words that he said that gave me so much hope, not only in that really scary moment, but throughout all of these tough times that I've mentioned. So he came into the room and the first thing he said was, I'm not going to do this today the way that I usually do this. I'm going to start with something different. Instead of going right into your treatment plan and the logistics for the next few days, I need you to make me 3 promises. The first is that you'll send me a card when you graduate high school. The second is that you'll send me a card when you graduate college. And the third is that you'll send me a card when you get married. And so I think this is just one of the best shining examples of hope throughout my experience. I clung on to those words. I obviously will never forget them. And fulfilling some of those promises, I fulfilled promise number 1, gave him a card when I graduated high school. And I'm not too far out from promise 2 here, just with a year and a half left of college. So I definitely clung on to those words in the darkest moments, and will never forget them.
I've struggled with it in my own practice. I'm a psychiatrist, and sort of the worst case thing for a young family is somebody in their teens starts hearing voices. And sometimes those resolve. You find out that it was due to a substance abuse, and they go on to have a fine life. And other times it's not. It's the start of a very long and hard journey. And I've been reluctant to give hope at those moments because I don't want to be wrong. I don't want to give false hope. So I don't know what my question is exactly, but how to strike that balance is something I've always found very challenging.
And I've reflected on that a lot, Josh, because there is that nuance as a physician where you do want to listen intently. You want to understand your words matter. You want to communicate clearly. You want to give hope where you can, but also not false hope. I think what I've come to realize, Josh, is we understood in that moment that there were no promises being given, but just any glimmer of hope was so motivating to her psyche and mentality to say, okay, I can do this. There is at least some hope here that I'm going to be able to get through this. Because up to that moment, in that first day, I mean, it all looks so bleak. You immediately think leukemia and your mind goes to the worst case scenario. So I guess my answer to that has become, I think patients can kind of sort out for themselves where that line lies between real hope and false hope, but just giving some means so much. And to us, that moment will stick in our memory forever. Just understanding a little bit, that was just him conveying to his humanity, and it helped us trust him in so many ways right off the bat, and helped us have a flood of emotions that we hadn't really had time to process, yet. And it was just a great start to the relationship, which is a key component, obviously, with physician and patient.
Amelia, when I first heard your story, I didn't think of any link to what we do professionally until you hit on one of your lessons, which was transitions are hard. And I was like, transitions. Now there's something we talk about. But tell me what transitions meant to you in that context.
Yeah, I mean, there was that initial and very quick transition for me from being what felt to me as healthy and having been healthy my whole life. And at that period, right before I was diagnosed, I was running my cross-country season, training very hard. And what felt like in the span of 24 hours, all of that changed. So that was kind of a transition from wellness to sickness. I went from being able to run a 5K to getting dizzy whenever I sat up in bed the next week. So that was a very, very intense, quick transition for me that required the support of so many people, not just my family and friends, but my medical team. Another transition I would point out is, as my dad said earlier, I had that port infection that we think caused the sepsis that weekend. And when we were kind of in the early stages of trying to treat that, when it kept kind of coming back multiple times, there was one point where my medical team sent me home with my port access and some IV antibiotics for us to administer at home so that I could have a week off of the hospital, or at least a few days off of the hospital when I had been in there so much over the last few weeks. They sent that home for us to do, for my dad to administer at home, and had to provide us with all of the materials and set us up logistically to be able to take care of that. And so that was kind of like a home healthcare situation that and transition that we needed support with.
Dr. Knopp, I know when you heard this, you drew the direct parallel to some of the work we do in accountable care. Do you want to comment on that?
Yeah, for sure. Because, what Amelia would also say is obviously she literally had too numerous to count transitions in and out of hospital and in and out of healthcare settings. And I was there with her. So trust me when I say I have a whole new appreciation for the importance to attention to detail and sometimes the perilousness of the transition in and out of hospital and back to home, and how important navigating those transitions are. So not only as a family and a patient, but as a healthcare team. And remember, in some ways, when you're in a childhood leukemia journey, your oncology team a little bit becomes like your primary care team because they manage everything all the time, seemingly 24/7. But I saw the parallels between how much it took to navigate those transitions, watch out for errors, make sure things happen the right way, quick follow-up phone calls the next day, quick follow-up appointments on an outpatient basis, after a hospital stay, to not end up back in the hospital again, a day or two later. Like that scenario I saw play out so many times. It just really drilled home the importance for me in primary care, how important navigating those transitions are for our patients. Just really, really brought that home.
And were there other areas where you saw the benefits or potential benefits of systems like value-based care that could help patients in situations like this?
Yeah, for sure. There were a lot of parallels for me between what we focus on in primary care and specifically in the value-based care space, and then what ended up being most important to Amelia on her take-home lessons. So, for example, one of her talking points is if she was speaking to you as a physician, Josh, she would say one of your greatest abilities is your availability. Well, to us in value-based care, that's all about access to care, right? So providing great access to care, gosh, her Children's Mercy team was literally available 24/7. I mean, phone call, text, email. I mean, there's just so many ways to communicate and access care, which was a huge foundational point. Managing the transitions, you know, obviously like a focus on in general, how do you travel a sickness journey while maintaining wellness? In a lot of spaces, that just takes a lot of oversight and attention to detail. Probably also, I think about value-based care being based on a relationship with patient and physician. And for sure, I think Amelia would agree like that. At the end of the day, that's actually what this is all about, which is the relationships you build between physician and patient and that level of trust that you establish. Feeling like whoever's taking care of you is actually truly accountable for your care at the end of the day, cares about you, and wants to give you the highest quality care possible. Like that's what resonated for Amelia, and obviously, as you guys know, ties right into value-based care.
Amelia, three of us keep using the phrase value-based care, but I didn't hear you once say that. What do those words mean to you?
Well, not too much to us, just regular people, I guess, non-medical people. But when I hear you guys talking about, compassion and accessibility to or availability in medical care, that means something to me. And also my hearing you talk about my medical providers being accountable for the decisions that they're making and making sure that quality is the highest quality of care that they can give me. That means something to me. And I, as a patient, even though I don't have that medical kind of lens or perspective that you guys do, I notice those things when I'm in the patient perspective.
Yeah, I don't know if physicians all think day to day about things like availability, accessibility, hope, relationship. But as you've described your journey, the best ones did. Did you have a sense of what was driving people to give you such attentive care?
I mean, my dad said it's all about the relationships. And I knew from that first weekend that I was in the hospital that I was building relationships with these people who didn't know me, but now we're going to put all that they had into caring for me, and also not just caring for me in that moment, but also helping me get back to where I wanted to be. And so I always say now I don't particularly love going back to the clinic or going to get my regular checkups, or just going back to the hospital in general. But I do, a little part of me is always happy when I go there because I love to check in with my team. We built such a strong relationship over those 2 3+ years, and I'm always happy to see them and check in with them. And they're always just so happy for me to see me back to doing what I love and accomplishing what I always wanted to accomplish. So I don't know if I have a great sense of what motivated them other than just out of compassion.
When we're choosing a cancer center for a family member, we may think about the statistics, the outcome, the pedigree of the place. But then what the patient takes away is these things that you're describing. Ryan, as you've gone through this, do you have a sense how we can communicate that to physicians without having to, spend a weekend on a cot next to their septic child in the hospital?
Well, in some ways, that's actually the journey that Amelia and I are on right now, which is we like to share our stories, kind of, we phrase it as, okay, healthcare at its best. What does that mean, from the patient perspective? What does it mean from a physician, father perspective? So we've shared this story in several venues. Actually, just a couple of weeks ago, we were at a local family medicine residency program and nursing training program where we talked to all the students there. So I think one of my answers to your question is just education, sharing stories, helping link what was most important and best about healthcare experience, and use that as a motivator for the new generation of healthcare people, that are coming into our profession. On that line of thinking, Josh, I've hosted recently some pre-med students, PA med students, and one thing I like to ask them on their first day is I say, what do you think the most important thing I'm going to do all day is? And they give all kinds of variety of answers. But then I say, it's a one-word answer, listen. That's the most important thing I'm going to do all day. Then I do usually ask a follow-up question, Josh, which is, now, what thing am I going to do today that saves the most lives? And you guys know the answer to that, which is I'm going to help manage high blood pressure. That's what I'm going to do that's going to save the most lives. But listening is the most important thing that I do on a day-to-day basis. So in some ways, Amelia and I kind of hope that sharing these stories, what resonated on a human level, a personal level, a patient care level, helps people to see, from an educational standpoint, maybe what it means, to deliver healthcare at its best.
So Ryan, as we come near the end, any lessons that we've missed that you want to share?
Yeah, I think, if I just had to summarize, sort of our talking points today, and this would come again from a patient perspective and then a physician perspective, just understand that as those of us who operate in the healthcare space, our words matter. Listening is super important. We are the advocates for our patients. You have to approach all things with humility. We can all get better at doing what we're doing on a day-to-day basis. Give patients hope where you can, communicate clearly, help them navigate those transitions, understand that focusing on high quality, patient-first, accountable care does resonate with patients and means something to them. Understand that access and availability is amazing and critical, but also, like Amelia said, at the end of the day, it's really all about the relationship. That really fosters one of your best healthcare experiences. So I reflect on all those lessons learned with Amelia, and as I said earlier, I'm proud to be her dad. I just am amazed by her strength and resilience and what she's gone through and still is going through, but her ability also to spin this into a positive and try to help people with her stories and messages. Again, I'll say it's pretty cool when your own kid becomes your hero in life, and I'll take it. Happy to help spread the messages and the words as we can here.
Yeah, Dr. Knopp, I was thinking the same thing. You and Amelia have embraced the positive and sharing the story. So, Amelia, before we wrap up, if you don't mind me asking, how are you doing now?
I'm doing well. I am probably at the healthiest point that I've been at since I was diagnosed. As I said, I had those 4 joint replacements, the last of which was over the summer. And so I'm, physically doing pretty well. I'm recovering from those joint replacements, trying to strengthen my joints and my body again. And so I've really enjoyed kind of building up my strength with walking, and I've gotten into stationary biking a little bit. I shoot baskets with my friends every once in a while. So I'm very grateful for that. And I have my first appointment with the Survive and Thrive clinic at my hospital in about a month. So I'm looking forward to that. That'll be another transition that I will be going through, but I'm definitely grateful for where I'm at. And there's not a day that goes by that I don't think about, the fact that there are people who are as lucky as me, and that I'm in the spot where I always hoped I would be, doing the things that I always dreamed of doing. So just trying to use that to the best that I can and do some good with that.
Well, Amelia Knopp and Dr. Ryan Knopp, thank you both so much for joining and for taking what was really a harrowing journey and helping us all learn from it to help the healthcare system be a better place.
Thanks, Josh.
Thank you.